In the BZAG trial, we tested different, we tested a combination of Venetoclax, Obinutuzumab, and Zanubrutinib in an MRD-guided fashion. So patients got at least 14 cycles, 14 months of combination treatment, but when they did not achieve undetectable MRD at a certain time point, they could continue treatment for up to 3 years almost. And what we found is that the rates of undetectable MRD were quite high, and we hardly saw any progression so far. So I think we had 2 or 3 progressions only but with a relatively short follow-up. But it shows that in a like really heavily pretreated patient population with also a lot of high-risk features genetically, we were able to induce deep remissions with this triple combination.